Did you know that after menopause, your risk for 13 serious diseases skyrockets? From heart attacks to brain fog, the shift is real. But you can protect yourself starting today. In this video, we'll count down the 13 conditions that silently rise after menopause and the simple, science-backed ways to fight back. And stick around because number 1 is one you absolutely need to know about for comprehensive protection. Before we dive into the specifics, it's crucial to understand why this increased risk happens. Menopause marks a profound biological shift, not just the end of menstrual cycles. The most significant change is the dramatic decline in the production of estrogen, a hormone that, for decades, has played a multifaceted protective role throughout your body. Estrogen isn't solely about reproduction. It's a key player in maintaining the health of your cardiovascular system, helping to keep blood vessels flexible and managing cholesterol levels. It's vital for bone density, regulating the constant process of bone renewal. Estrogen receptors are found in the brain, influencing cognitive functions and mood. It also impacts how your body metabolizes fats and sugars, affecting weight and insulin sensitivity. When estrogen levels plummet during and after menopause, these protective influences wane. This isn't a sudden failure, but rather a recalibration of your body's systems without the same levels of hormonal support they once had. This recalibration can leave various organs and systems more vulnerable. For instance, without estrogen's vascular benefits, arteries can stiffen. Without its support for bone turnover, bone loss can accelerate. Changes in fat metabolism can lead to weight gain, particularly abdominal fat, which itself is a risk factor for several conditions. Understanding this fundamental hormonal shift from a state of estrogen abundance to one of relative deficiency is key to grasping why the landscape of health risks changes so significantly after menopause. This knowledge isn't meant to cause alarm, but to empower you with the understanding needed to take targeted, proactive steps towards safeguarding your future health. 13. Depression and anxiety disorders. The menopausal transition can be a vulnerable time for mental health, with an increased risk of developing or experiencing a recurrence of depression and anxiety. Estrogen is a key player in our brain's chemistry, influencing mood-regulating neurotransmitters like serotonin. When hormone levels are fluctuating and then declining, it can unsettle this delicate balance. This, combined with other life changes or stressors that might be happening around the same time, can make us feel more vulnerable. Please know that if you're feeling this way, it's okay, and there's support available. Regular physical activity is a wonderful natural mood lifter. Gentle stress management practices like mindfulness or yoga can bring a sense of calm. Prioritizing sleep and staying connected with supportive friends and family can also make a huge difference. And most importantly, if you're struggling with persistent low mood or anxiety, reaching out to a therapist, counselor, or your doctor is a sign of strength. There are many effective ways to help you feel like yourself again. 12. High blood pressure, often called hypertension, is something that can creep up on us, especially after menopause. Estrogen has a knack for helping our blood vessels stay flexible and open, which keeps blood flowing smoothly. When estrogen levels decrease, our blood vessels can become a little less elastic. It's like a garden hose that's not as pliable as it used to be, meaning the heart has to work a bit harder. This isn't a cause for alarm, but a call to be mindful. The DASH diet is a fantastic, gentle approach. It's all about enjoying plenty of fruits, vegetables, whole grains, and low-fat dairy, while being easy on sodium and red meat. Moving your body in ways you enjoy also helps. And simple things like managing stress, limiting alcohol, and not smoking can make a big difference. Keeping an eye on your blood pressure with regular checks is a great habit, and your doctor is your best partner in creating a plan if it's a bit higher than ideal. 11. Osteoporosis is a condition where our bones become less dense and more fragile, making them more prone to fractures. It's often called a silent condition because you might not know you have it until a bone breaks. Estrogen is a true champion for our bones, playing a vital role in keeping them strong by overseeing the constant renewal process where old bone is cleared away and new bone is built. After menopause, when estrogen levels drop significantly, this carefully balanced process can be disrupted, and we can start to lose bone faster than we build it. It's a natural process, but one we need to be proactive about. To keep your bones strong and resilient, make sure you're getting enough calcium and vitamin D. These are the building blocks for bone health, found in dairy, leafy greens, and fortified foods, or supplements if needed. Weight-bearing exercises, things like walking, jogging, or dancing, and muscle-strengthening activities are fantastic because they gently tell your bones to stay strong. Avoiding smoking and limiting excessive alcohol are also kind to your bones. Chat with your doctor about a bone density scan, DEXA scan. It's a simple way to see how your bones are doing and discuss if you might need extra support. 10. Osteoarthritis, a degenerative joint disease characterized by the breakdown of cartilage, the cushioning tissue between bones. While getting older is part of it, the hormonal shifts of menopause, especially lower estrogen, seem to play a role too. Estrogen is thought to be a bit of a guardian for our cartilage, helping to keep inflammation in check. When estrogen dips, some women find their joints might feel a bit more achy or stiff. It's your body signaling that your joints might need some extra care. One of the kindest things you can do for your joints, especially your knees and hips, is to maintain a healthy weight. Gentle, low-impact exercises like swimming, cycling, or a lovely walk can strengthen the muscles that support your joints and keep you flexible. And of course, being mindful to protect your joints from injury is always wise. If your joints are persistently talking to you with aches, a chat with your doctor can help you find the best ways to soothe them. Before we continue, if you are enjoying this video, give it a like. It tells YouTube to recommend it with more women. Subscribe or share with your friends that might need it. 9. Stroke. It happens when the blood supply to a part of the brain gets interrupted, and it's a serious concern that sees an increased risk for women after menopause. This is very much tied to the loss of estrogen's protective embrace on our cardiovascular system. Before menopause, estrogen helps keep our blood vessels flexible and healthy. After menopause, things like an increase in blood pressure, less favorable cholesterol levels, and stiffer arteries can become more common. Conditions like atrial fibrillation and irregular heartbeat that can lead to clots also become more likely. All these factors can unfortunately raise the risk of a stroke. Protecting yourself involves taking good care of your overall heart health. This means managing your blood pressure and cholesterol with a healthy diet, regular movement, and medication if your doctor advises it. If you have diabetes, keeping it well controlled is crucial. Not smoking is one of the most powerful things you can do. Maintaining a healthy weight and staying active are also vital. And please, be aware of the signs of a stroke. Remember, FAST, face drooping, arm weakness, speech difficulty, time to call emergency services immediately. 8. Cognitive decline. Some women report experiencing brain fog, difficulties with memory, focus, and mental clarity during and after menopause. That feeling where words are on the tip of your tongue or it's hard to focus, something many women report during and after menopause. It can be unsettling, but there's a reason for it. Estrogen receptors are all over our brain, and this amazing hormone plays a part in how clearly we think and remember. So when estrogen levels change, it can temporarily affect our mental clarity. It's usually not a sign of something more serious, but your brain adjusting. To help keep your mind sharp and clear, think of it like exercising a muscle. Engaging in activities you enjoy that also stimulate your mind, like reading, doing puzzles, learning a new skill, or a favorite hobby, can be really beneficial. Nourishing your brain with a diet full of antioxidants and healthy omega-3 fats, think colorful fruits, veggies, and fatty fish, is also a great idea. Regular physical activity gets blood flowing to your brain, and managing things like blood pressure and cholesterol helps too. And don't underestimate the power of good sleep and managing stress for a clearer mind. 7. non-alcoholic fatty liver disease. Often called NAFLD, is a condition where there's an extra buildup of fat in the liver, and it's not related to alcohol. After menopause, our bodies change how they handle and store fat, partly due to those shifting estrogen levels. This can sometimes mean more fat settles around our middle and, unfortunately, in our liver. It's a gentle nudge from our body telling us to pay a bit more attention to our liver health. To give your liver some love, think about maintaining a weight that feels good for you. Often, that's the biggest helper. Filling your plate with colorful fruits and veggies, whole grains and lean proteins, while being mindful of processed foods and sugary drinks can make a real difference. And moving your body regularly, that's a fantastic way to manage weight and keep your insulin working well. If you're managing other conditions like diabetes or high cholesterol, keeping those in check is another great way to support your liver. 6. Genitourinary syndrome of menopause is a common condition that can affect the vaginal and urinary areas after menopause, and it's all down to lower estrogen levels. Estrogen is like a natural moisturizer and strengthener for these delicate tissues. When it decreases, you might notice things like vaginal dryness, itching, or discomfort, especially during intimacy. You might also find you need to visit the bathroom more often or are more prone to urinary tract infections. It's your body's way of saying these areas need a little extra TLC. The good news is there are simple, effective solutions. Over-the-counter vaginal moisturizers used regularly and lubricants for intimacy can bring a lot of comfort. If symptoms are more bothersome, please chat with your doctor. Low-dose vaginal estrogen therapy, creams, tablets, or rings, works directly where it's needed, is very safe for most women, and can make a world of difference. And remember, being gentle with yourself by avoiding harsh soaps in that area can also help. 5. Obesity. Many women find it harder to maintain their weight after menopause, often experiencing an increase in overall body fat and a shift towards more fat storage around the abdomen, visceral fat. This is linked to the decline in estrogen, which influences metabolism, fat distribution, and even appetite regulation. A slower metabolism means the body burns fewer calories at rest, making weight gain easier if dietary habits and activity levels don't adjust accordingly. To protect yourself, focus on a balanced, nutrient-dense diet that's portion-controlled. Prioritize regular physical activity, incorporating both cardiovascular exercises, like brisk walking, swimming, or cycling, to burn calories, and strength training to build and maintain muscle mass, as muscle burns more calories at rest than fat. Ensure you're getting adequate sleep, as sleep deprivation can affect hunger and metabolism-regulating hormones. Manage stress, as chronic stress can also contribute to weight gain. 4. Type 2. Diabetes. The risk of developing type 2 diabetes increases after menopause. Estrogen actually helps our body's cells listen to insulin, the hormone that manages our blood sugar. When estrogen levels are lower, our cells can become a bit less responsive to insulin. This is called insulin resistance. It's like insulin is knocking on the door, but the cells aren't opening up as readily. This, along with potential weight gain and changes in where our body stores fat, often more in the tummy area after menopause, can make it harder for our body to keep blood sugar in a healthy range. To help prevent this, maintaining a healthy weight is really key. A diet filled with fiber from whole grains, fruits, and vegetables, while being mindful of sugary foods and refined carbs, can make a big difference. Regular physical activity is also a star player because it helps your cells become more receptive to insulin. If you have a family history of diabetes or other risk factors, regular checkups with your doctor for blood sugar screening are a wise step for early awareness. 3. Insomnia. Many women experience significant sleep disturbances like insomnia after menopause. Those infamous hot flashes and night sweats, they're often the main culprits, waking you up just as you've drifted off. These are usually thanks to our changing estrogen levels playing with the body's internal thermostat. Beyond that, the emotional shifts, like anxiety that can come with menopause, can also make it harder to quiet the mind at bedtime. It's important to remember you're not alone in this. To invite better sleep, try creating a peaceful bedtime routine. A consistent sleep schedule, a cool, dark, quiet bedroom, and perhaps avoiding caffeine or alcohol in the evening can help. If hot flashes are really disruptive, your doctor can discuss options. And if worries are keeping you up, addressing those with relaxation techniques or even talking to a professional can be incredibly helpful. Cognitive behavioral therapy for insomnia, CBTI, is a wonderful medication-free approach that many find effective. 2. Dyslipidemia. Dyslipidemia means you have unhealthy levels of lipids, fats, like cholesterol and triglycerides, in your blood. You might hear about LDL, the not-so-great cholesterol, and HDLs, the helpful cholesterol. After menopause, it's common to see LDL and triglycerides, another type of fat, go up, while HDL might dip. Our friend estrogen actually helps keep these fats in a healthy balance. So when estrogen levels change, that balance can shift. It's not your fault, it's just your body adjusting. To help your body find its new balance, a heart-happy diet can be wonderful. Think of foods rich in soluble fiber, like a comforting bowl of oatmeal or some hearty beans, and healthy fats from sources like avocados or a sprinkle of nuts. Regular, enjoyable movement, like a brisk walk, can also encourage those helpful HDL levels to rise. Keeping a healthy weight and steering clear of smoking are also big pluses. Your doctor can easily check your cholesterol with a simple blood test and can chat with you about options if lifestyle tweaks need a bit of extra support. 1. Heart disease. Particularly coronary artery disease or heart attacks is a topic that deserves our utmost attention. For women, the risk of heart disease truly skyrockets after menopause, becoming the leading cause of death. Before this life stage, estrogen acts like a guardian angel for our cardiovascular system. It helps keep our blood vessels flexible and healthy, promotes good blood flow, and has a positive influence on our cholesterol levels. When we lose that high level of estrogen, these protective effects diminish. Arteries can become stiffer and more prone to plaque buildup. Blood pressure often rises, and cholesterol profiles can shift in an unhealthy direction. These changes, happening quietly inside, significantly increase the risk of a heart attack. But please hear this: there is so much you can do. Embracing a heart-healthy lifestyle is incredibly powerful. This means filling your plate with vibrant fruits and vegetables, whole grains and lean proteins, while being mindful of saturated fats, trans fats, and sodium. Think of the wonderful Mediterranean or DASH style of eating. Regular physical activity, aiming for about 150 minutes of moderate activity like brisk walking each week, is crucial. Maintaining a healthy weight, choosing not to smoke, and limiting alcohol are also key. And very importantly, work with your doctor to manage any other risk factors like high blood pressure, high cholesterol, or diabetes. Regular checkups are your friend in keeping your heart healthy and strong for all the years to come. If you've made it this far, congratulations. These 13 conditions aren't trends. They're potential health challenges that become more prominent after menopause, largely due to hormonal changes. But knowledge is power, and these insights are your tools. Tools to help you understand your body, advocate for your health, and take proactive steps to protect yourself. Start small. Perhaps focus on one dietary change or add a short walk to your daily routine. Listen to your body. Let the change grow from there. If you found this video helpful, give it a like. It tells YouTube to share it with more women who need this message. Subscribe for weekly videos on menopause nutrition, hormone balance, and smart strategies to feel like yourself again, strong, clear, and in control. And comment below which of these 13 conditions or the information about them surprised you the most. You've got this, and I'm here to guide you every step of the way.